All right, thanks for checking us out today. We're going to go through the most frequently asked questions about LASIK. I'm here with board certified ophthalmologist Dr. James Kelly. My name is Steve. So many questions all the time you get about LASIK, so we're going to go to the top questions.
Yeah, I really like doing this. I do this in person with my patients during their consultation, and I'm really excited to do this now online with you.
So, Amanda in Fresh Meadow says, LASIK, does it hurt?
Well, I get asked this all the time. And during the procedure, I had it performed in my own eyes many years ago, and you've had it done.
Yep.
And during the procedure, there's a little bit of pressure, but most patients will describe it as mildly uncomfortable during the procedure. Now, having said that, for a few hours after the procedure, patients will be in discomfort. And that may last for a few hours. They may have some burning, some tearing, some light sensitivity,
A little itchy sometimes.
little
It all
headache,
depends on who you are.
and it can be unpleasant for a few hours. But what I like to tell them is that a few hours of discomfort after the procedure for a lifetime of good vision is worth it.
Now, the other question we get a lot, a couple of people have actually asked it, can you go blind from LASIK?
Well, it's another thing I get asked every day I'm at work. No. The answer is absolutely no, unequivocally no. There are side effects that patients have to be aware of, and we discuss them in person, and we give them these side effects in written form and ask that they review them. There are things like dryness, light sensitivity, haloing, and we discuss these with patients, and I encourage people to come in and get an in-depth consultation with me in person.
All right, we're looking at the most frequently asked questions about LASIK. I've got Jose in Brentwood. What's up, Long Island? What does LASIK cost?
Well, there's a range of costs for LASIK, and usually it winds up being anywhere from $3,000 for both eyes to $5,000 for both eyes. It all depends on the type of technology that's used and the policy of aftercare that's given to the patient, and any discounts that they may be that may be open to them depending on what they do for work or a type of insurance company that they are affiliated with.
I'm going to get a question now that is very much connected to that. Jen's in New York City. She says, what's the difference between all the LASIK specials that are out there?
Well, yeah, this is something that I deal with on a regular basis, and I'll say that there's a lot of false advertising out there. People get these emails saying that LASIK is $199 an eye or $299 an eye. Well, that's not true. A lot of these businesses that promote those low prices are doing this with sort of a bait and switch mentality, where they patient comes in thinking they're going to get this really low price, and then they're told they don't qualify. And maybe they do this on 1% of their patients, but the real goal is to get them to come in thinking they're going to get a low price, and then they upsell them to something far, far more expensive than what they're advertising. And frankly, I find that really dishonest and not a way to start a relationship with a patient.
And then now you get into quality of care. I mean, a lot of those different practices aren't, the doctor is not with the patient the entire time. When you're different about that, you're from the consult all the way to the end, the post-ops, they see you.
Yeah, and I talk about the Kelly difference, and the difference is in my practice as the board certified eye surgeon, I do the consultation myself. I perform the surgery myself on the machines that are here behind us, which represent the latest FDA-approved technologies, and I see my patients after the procedure myself rather than delegating their eye care to someone else, and that's what many places do.
Frequently asked question we get, here's one from Kara in Westbury. She says, my friend told me that you have to go back for LASIK after you have it. Is that true?
Well, this is something where people are under this false notion that LASIK wears off.
It's funny because somebody asked, is it permanent?
Yeah, when I can tie these together because LASIK is designed to be a permanent correction of your distance vision. However, people's eyes change over time. Just like you go for a pair of glasses, sometimes you go back a few years later and the prescription changes, and the same thing is true with contact lenses. Well, your eyes can change over time, and sometimes an adjustment, we refer to them as enhancements or touch-ups, have to be done to bring a person to their optimal level of vision. And people want to know, well, how often does that happen? What's the risk of that happening? And I say it's about 10% in my experience over the last 25 years. So this is something that can happen, but it's pretty uncommon when we look at it.
I'm going to grab my glasses for a second here to read the next point.
Yes.
Yes, I have glasses. I had LASIK. We should actually explain that.
Well, yeah, I'm glad you're doing this, Steve, because you and I both have had LASIK many years ago in the 90s. And part of the natural aging process, whether a person has had LASIK or not, is as they get to middle age, they lose their ability to focus up close. And we do procedures on patients that are middle-aged or older to get rid of their reading glasses, even if they've had LASIK when they were younger. So you're not wearing reading glasses because you had LASIK 20-something years ago. You're wearing reading glasses because you're old.
Thank you. That felt great.
Just trying to keep it real.
Yeah, but you know what? It's reality. But there's ways to fix that.
Yeah, and actually half my practice is doing procedures on patients to get rid of their reading glasses.
Final question we have, and that comes from Lauren, who is in New York City, and says, how long does LASIK take? The actual procedure she's asking about.
So the procedure takes about 10 minutes from beginning to end, as does SMILE takes about 10 minutes, or PRK. So all the forms of laser vision correction take about 10 minutes for both eyes. It's actually much faster to do the procedure than it is to do the consultation. The consultation can take 20 or 30 minutes, where the procedure takes about 10 minutes.
So I'm ready for the consultation to get rid of these. And I thank everybody for your questions today. If you have any questions for Dr. Kelly, you can message us on Facebook or get a free consultation. Go to the website, click the button, and come on in, and Dr. Kelly will personally meet you and answer all the questions that you have. Thank you very much for hanging with us.
Yeah, thanks for your time today, Steve.